Deficiency in Vitamin B12 and D, an informational video by Safe Sharth. So to start off, what are vitamins? Vitamins make up a part of our diet called micronutrients. So our diet is composed of macro and micronutrients. Macronutrients include your fats, your carbs, and your proteins. And then your micronutrients include your vitamins and your minerals. So these are things like vitamins A, B, C, as well as minerals such as sodium and magnesium. So vitamin B12 has quite a few functions in your body. It can help with your heart, your nervous system, your brain, your blood, and it can even help preventing cancer. Some symptoms of deficiencies will include headaches, indigestion, feeling fatigued or tired, and heart palpitations. So there's quite a few reasons as to why someone might be deficient in B12. One of the more common causes will be through diet, and this will include such as following a vegetarian diet or a vegan diet. And then some of the other causes include medications such as metformin, hormone replacement therapy, and then could also be from surgery, which is kind of any surgery which removes part of the gut because that is where it's absorbed, and then some medical conditions such as Crohn's and celiac disease. So what can we do about vitamin B12 deficiency? So one of the main things is to try and improve our diet and have a more balanced diet. So this can include things like having a bit more meat, a bit more fish, including a bit more dairy in your diet as well. But if you are found to be deficient in B12, an alternative could be supplementation, and this can include having regular injections of something called hydroxycobalamin, which is essentially just a fancy word for vitamin B12. So moving on to vitamin D, most people in the UK will be deficient with vitamin D. Vitamin D is important for things like bone health, your heart health, and it can even help with preventing cancer and lowering blood pressure. The main symptoms of deficiencies will include bone pains, breaking your bones a bit more easily, and in children, we tend to see some bone deformities. So why would someone be deficient in vitamin D? One of the more common causes will be through exposure to sunlight or lack thereof. And then there could also be some medical conditions similarly to vitamin B12, such as Crohn's and celiac disease. If you do have darker skin, that could also affect how much sunlight you absorb and therefore how much vitamin D your body can make. And then also through diet, so things like vegetarian, vegan, and also if you suffer from an eating disorder, this can lead to a vitamin D deficiency. So what can we do about vitamin D deficiency? Now, our bodies can make vitamin D from sunlight. So ensuring that we get enough exposure to sunlight will be beneficial in making sure that we have adequate levels of vitamin D. Other sources of vitamin D will include things like oily fish, like salmon and sardines, but also meat and dairy. I hope this short informational video was of benefit to you. If you would like more information, then you can visit the NHS website. However, you could also book an appointment with the GP if you would like to talk to a healthcare professional.